Hello, welcome to another time of health and wellness with Olajumoke. Today, I'll be talking about how we can live with people with autism. I'm sure one or two of us must have someone, either a child or an adult living with autism. And because we want this world to be a better place, we must learn to live with these people, understand them, and help them in any way we can. So to start with, I like to define what is autism. Autism, also known as autism spectrum disorder, are developmental disabilities that can cause behavioral, communication, and social challenges. Now, let's check what are the facts about autism. 1. Autism is not an illness, just like many people may think it is. It is not an illness. It's a developmental disability, just as it was defined. Number 2, people with autism can live full life. They can live normal life. In fact, many people don't know they have it until they are well advanced in years before they get the diagnosis, and they just continue living. Some of them don't know until they have some comorbidities. What are comorbidities? Like accompanying conditions. What are these conditions? Maybe they have some additional anxiety, depression, dyslexia, attention deficit hyperactivity disorder, also known as ADHD. When people have other symptoms like this and then the provider look further, they may see that such people are also may have autism all their life and they may not know. So people may not know and they may grow with autism over time. The third fact I like to establish here is autism is different from everyone, and that's why it's a spectrum. What does it mean by spectrum? Meaning people do have different manifestation of autism. You can see someone with autism whose manifestation differ from the other same person with autism. So they have different manifestation, and it is not the same for everyone. They have different things they stand out with, and they have different things they have low ability to do. So now another thing I also like to point out is people with autism have different level of intelligence. You can see someone with autism who have a very high level of intelligence, and you can see someone with autism who have a very low level of intelligence. Okay, so having established this, I also like to point out this salient point. The cause of autism is not known. Medical world have not been able to identify the specific cause why people have autism, but there is high chances that if a parent have autism, they can pass it down to their children. Does this mean that every child with autism have a parent with autism? No, that is not true. A child with autism does not necessarily have a parent who have autism, but there are high chances that if a parent have autism, they can pass it down to their children. Now, next, I'll be talking about the characteristics we may see or observe in people who have autism. 1, people who have autism find it hard to communicate and interact with other people. Number 2, people who have autism find it hard to understand how other people think or feel. They may find loud noise or bright light uncomfortable, stressful, or overwhelming. People with autism may get upset or anxious about social events or unfamiliar situation. People like this also may take longer time to understand information, and they may have repetitive behavior, meaning they may repeat the same thing over and again, either be it a child or even in their adulthood. Now, having established this fact about their characteristics and the fact on autism, I would like to point out what are the tips that can help us, our world, to live with people with autism. 1, we need to be very, very patient with this individual. We need to be patient. If you have a child, a friend, a colleague with autism, you need to learn to be patient with this individual. Number 2, we need to be persistent when giving instructions to these people. We need to be persistent and resilient We need to be persistent and resilient. So you keep repeating your instructions if it is needed, because these people may need more than you telling them one thing once for them to understand. You may need to repeat instructions, just like I pointed out earlier. Number 3, if you have a child with autism, you need to ignore attention-getting behavior. They have a tendency to have attention-getting behavior. When you see unhealthy behavior, you don't promote it by giving it attention. No, you don't promote it. You reduce those attention by giving those attention less attention. I don't know if that makes sense, but don't pay attention to those behaviors that will make them keep coming back, especially when they are not positive behaviors. Another point I like to emphasize is, for someone who have a child or a friend with autism, is for you to build on their interest. They usually have something they like doing. If it is positive, then build on it. It will help them come out of their shell and to grow and develop. Another thing I also like to point out is to stay positive. I know it is very hard living with someone who have autism, but we must stay positive that things will get better. It will definitely improve. They won't be like that. They would always improve over the time, over the years, but we need to stay positive. And then I like to talk to parents who may have a child with autism. You need to be patient. I would also suggest you having support system, people you can talk to, who you can express how you feel about your child to, who can come alongside with you, comfort you, give you extra support as needed. Number 3 that I would say to parents with a child with autism is to join support groups. Support groups are very helpful. It gives you opportunity to hear other people going through the same thing you are going through, who have some tips on how they resolve those situations, which can be helpful for you in this present time. So there are different support groups out there that you can join for those with autism. I know specifically there is this group on Facebook called Autism Support Group for Families. You just need to type it that way on Facebook and request to join. When they review your request, there is a high chance that they will allow you to join. Joining this group will give you opportunity to come alongside other people who have children with autism, learn from their experience, apply it, and then be better. This is one out of many other groups you can find online. Number 4, I will also encourage you to look up speech and occupational therapy if you have not started. If you have a child with autism, I will encourage you to look up speech and occupational therapy, or discuss it with your physician. Ask them about it, how you can get one program or the other for your child. And that program I know that is out there that can help parents with a child with autism is called Applied Behavioral Analysis Therapy, ABA therapy. People have found ABA therapy very helpful. It helps to build out the positive behavior in children and to minimize negative behaviors, like positive reinforcement for positive behavior. These are my little tips for you parents at this time. If you know anyone who have a child living with autism who need extra support, please kindly refer them. You can share this video with them. You can give them my email just like you know, or you can give them my number if that's fine by you. Till we'll meet again on Health and Wellness with Olajumoke, I want to encourage you to stay healthy, stay positive. Bye for now.